And we're going to start our briefing today with Dr. Moreno from our health department, who's just going to give us an update on things COVID-19. Good afternoon, Dr. Moreno.
Yeah, good afternoon, Maya. Hello, everyone. So I'll start by saying that the local testing, local vaccine, and vaccination data are on our website. So I encourage people to visit the website to look at that data. Moving on, the information I'm providing is all on California's website, and that includes the fact that business sector guidance has been terminated now, but businesses will still need to adhere to Cal-OSHA emergency temporary standards. And then as far as CDPH guidance, the updated CDPH guidance is now in effect. That includes the CDPH guidance for face coverings, also guidance entitled Beyond the Blueprint Framework for Industry and Business Sectors, and that goes into detail for requirements for mega events. And there's also updated COVID-19 reopening in-person instruction for K through 12 schools in California. That was updated to align with the state mask order, which was updated. And we're told by California Department of Public Health that when the CDC issues an updated guidance for schools, CDPH may review and may update their state guidance for schools. And then finally, CDPH recommends that Californians follow CDC travel guidance from this point on. So that's my update. Thanks, Mia.
All right, thank you very much. And then we're going to go on to our next doctor. We're very pleased to have Dr. Chad Harris from the Natividad Medical Center join us today. He's going to talk a little bit about Esperanza Care. And many of you may remember when Esperanza Care started as a pilot program back in 2015, and it's really become a wonderful safety net program for people in our community. And now there's another expansion ahead. Good afternoon, Dr. Harris.
Thank you, Mia, and hi, everybody. Happy to talk about Esperanza Care and to make the announcement we're expanding services. Like Mia mentioned, it started back in 2015 as a pilot and then evolved into Esperanza Care as we know it in 2017 with 3,500 folks that could be served. Really important program that serves our uninsured residents in Monterey County. It was originally developed as a partnership with COPA, the county, including the health department, clinics, as well as Natividad. So starting on July 1, we are expanding enrollment to 4,500 residents here in the county who are uninsured with expanded funding. I think it's great news for these residents. Just to review several key elements of this so folks can understand. This is for the uninsured, those that are 26 years old and older, and 138% of the federal poverty level. What's actually covered, I think that's important as well. So this is not insurance per se, but it is a very important mechanism and a way to provide healthcare services at Natividad. Specifically lab services, radiology services, and specialty services. And when I say specialty, I am meaning your specialty surgeons or medical providers. And then also there's a pharmacy or prescription component of this that is available to those that are enrolled. And very key is primary care is provided by the health department clinics. How do you apply? So reach out to the health department or us here at Natividad, and then our partners at Pacific Health Alliance at 1-800-533-4742. And just a reminder for those enrollees, the patient would first need to see one of the health department primary care providers, and then they would refer for these additional services. So lab, radiology, those specialty clinic appointments like I mentioned. And again, very excited to announce this expansion, and Natividad is committed to this program and then ultimately providing better care and high quality care to the folks that are enrolled.
Wonderful news. great news, as a matter of fact. And thanks very much for sharing the information about the expansion. And then Dr. Harris, if you're able to stay on the call for a little while in case we've got some additional questions for you about Esperanza Care, that would be terrific. Now we're going to move on to our next topic, which is the Military and Veterans Affairs Office. This is a very hardworking department. They serve a lot of veterans in our community, and they are getting new offices. And we've got folks lined up to talk to us about those new offices, although for some reason I am not seeing them on the call right now. So we're going to jump to our next topic and see if I can't get a hold of folks from Military and Veterans Affairs Office to join us on the call to talk about their new offices.
May I?
Yes.
May I? I think Mr. Cameron's unable to get onto the call, so I forwarded him the information.
Oh, super. Thanks very much, Dr. Moreno. You're now my tech support. You've got a new job. But so while we're waiting, I see Sean Ellerby is on the call, and she's going to talk about a new opportunity for folks at our county parks. There's a free park day use program going to be implemented for the next year. So give us the good news, Sean.
Thank you, Maya. Good afternoon, everyone. At this upcoming board meeting on June 22nd, the Monterey County Board of Supervisors is set to adopt the county's fiscal year 21-22 budget. And included in that budget will be the rescinding of charging park entry fees at the following parks effective July 1st, 2021. And those parks include Royal Oaks Park, Jack's Peak Park, Tora Park, and San Lorenzo Park. The park entry fees will stay in effect at the resort and recreation area at Lake Nacimiento, the North Shore, Lake San Antonio, which would include the Los Robles Equestrian Center, South Shore, Lake San Antonio, and the Laguna Seca recreational area. Fees for camping, picnic areas, buildings will still apply. All other park user fees will remain in effect. And the latest park user fee article can be found out on the county's website under the Public Works Facilities Parks Department, County Parks, under rates and reservations. That's it.
Oh, boy, that's enough. I'm sure there are a lot of people pretty happy about being able to come to the parks with free. And there is a graphic available with all this information that I'll be sending out to all of our media partners just to follow up. And so you can just a reminder of what Sean was talking about and what does and does not apply in this program. Thanks very much, Sean, if you stand by in case there's any questions.
Will do. Thanks, Maya.
Thank you. And now we have Jason Cameron from Military and Veterans Affairs joining us. Glad you could get on the call, and we're really excited to hear about your new offices. Tell us, where you are and where you're going to be.
Absolutely. Thank you so much. So my name is Jason Cameron. I am the Director of Military and Veterans Affairs for the County of Monterey. And we're currently, our main office is located in the courthouse in Monterey off of Aguajito. And we've been here for quite some time. We also have a couple other small offices, one in Salinas and one in the VA clinic in Marina. However, due to the growth of our veteran population over the last couple of years and increasing our staff sizes, we were able to actually identify a new location in Marina in the coastal office there. It's county office in Marina at 2616 First Avenue. In Marina. It's actually the same building that Supervisor Askew is in. And the building became vacant, and with the exception of the supervisor's office being located there. And we talked with multiple different entities and got full support from the Board of Supervisors to make the move, in addition to rehabbing the building as it's not currently set up to be functional for our needs. So we were able to obtain some funding from the Board of Supervisors to create a building that will really be sufficient in serving the veterans of our county, and we're super excited about it. So that move hopefully should happen here within the next 6 to 8 months, I'm imagining. So thank you.
Thank you. And before we go to other questions, by having this new office, how can you better serve the veterans? Is it more space, more ability to have more staff? what can you provide soon that you really are having trouble providing now?
Absolutely. So, one of the situations where we're currently at is, we're located in the courthouse, and we're downstairs in the courthouse. There's some limitations for ADA, although there is an elevator, but you still have folks going through the metal detector and that type of stuff, and it becomes a bit cumbersome. So just ease of access is one thing. The second is that Marina's a bit closer for those individuals that we have who are living in Castroville or Prunedale, even Salinas. It's a quicker drive to Marina than it is to come into Monterey. So access in those ways, a much bigger footprint. And in addition, we're also looking to create essentially a veterans services building is what we're looking at. We're going to have other partners co-located there with us. So we're reaching out to different nonprofits and other government entities that serve veterans specifically. For example, the Vet Center out of Capitola, which is part of the VA system. We're in talks with them to have a remote site for them to be able to provide services to our veterans in the county. So we're looking to be able to really bridge that distance gap dramatically by having office space here that's adequate for these other service providers providing services to our veterans, in addition to some homeless resources through Nation's Finest. And then we have VTC, obviously, right down the street. So we're looking to really make this a robust veteran-specific effort. In addition to the space, we've also increased our size from an employee count. So we do have more employees, but we're also going to have a lot of meeting space room. And when you look at the Monterey County, you know that we're very rich in military history, and we have a big veteran population. And there's a lot of veteran organizations, for example, Veterans of Foreign Wars, American Legion, Disabled American Veterans. A lot of those organizations have meeting rooms, but some of the smaller ones like the Retired Enlisted Association or MOA, which is the Military Officers Association, they don't have meeting areas. They don't have a building that they meet at. So they need those, they need to leverage relationships that they have to borrow meeting rooms. And what better place than to meet at the Military and Veterans Affairs office in one of our meeting rooms? It's really creating a great space for all things military and veteran in the county that we serve.
Great. Thanks very much, Jason. And if you'd stay on the line in case we've got some more questions for you, that would be terrific.
Will do.
So we're going to go ahead and get started with the questions that we have. A lot have come in. Our first question is for Dr. Moreno. Dr. Moreno, why has the number of COVID-19 vaccine doses received in Monterey County decreased so much?
All right, May, that's a good question. So when we were early on in our COVID vaccine campaign, we had a demand for vaccine that exceeded the supply of vaccine. And so Monterey County Public Health was receiving requests from healthcare providers, vaccine providers for vaccine, and we were recommending that the state send those orders and deliver those requested doses to the providers, and they were using up the vaccine about as fast as they were receiving it. As time has gone on, and as most people who were very eager to get the vaccine have already been vaccinated, we have we're left with people who are a smaller number of people who are still perhaps struggling to find a way to get vaccinated. And we have individuals who are still not sure they're going to get vaccinated. And so the demand is starting to decrease. However, at a point in time, the state moved the responsibility of vaccine ordering and allocation from public health to Blue Shield, the third-party administrator. And the third-party administrator continued to send vaccine out to providers, and the providers would continue to receive vaccine. And so at that point, what I believe was happening is their supply or the deliveries were beginning to exceed the demand for vaccine, or at least their ability to vaccinate in the same numbers that they were vaccinating in the past. And so over the last few weeks, the providers have been sharing that they have enough vaccine for now to last them for a while. And so they don't need to order in the same quantities that they were ordering in the past. So the providers are focused on trying to use up the vaccine that they have on store before ordering additional vaccine.
Thank you very much. And another question for you. Has the Delta variant shown up in the state and in Monterey County?
I'd have to check on that and get back to you, Matt.
Okay, thank you. Another question for you, Dr. Moreno. Is the epidemic over in Monterey County?
Man, we still have cases of COVID. We still have people being hospitalized, and occasionally we have people dying from COVID. It's still being transmitted, not just in Monterey County, but it's being transmitted in California and the rest of the United States and across the globe. We have countries, we have some countries that have a very, very small percentage of their population that have been vaccinated. Some countries have less than 5% of their population vaccinated, and they still have high numbers of hospitalization cases, hospitalizations, and deaths. So globally, there's still quite a bit of evidence that the virus is having a significant impact on populations throughout the world. And so this pandemic continues, and it will continue until other countries are able to acquire a vaccine that's adequate enough to begin to vaccinate a significant portion of their populations.
Thank you, Dr. Moreno. A question for you, Dr. Harris. Thanks for staying on the call with us. How great would you estimate is the need for in regards to Esperanza Care for the uninsured? Esperanza Care, as you mentioned, is expanding to 4,500 clients. What portion of the uninsured do you believe the expansion covers?
Well, I think the need is great, and it is significant. The approximate number of uninsured individuals in the county is roughly 45 to 50,000. So this expansion to 4,500 does significantly help that, but doesn't entirely close the gap.
And then another question related to this, could you repeat the name of the health partner with the 800 number, I believe, for people to sign up for?
Sure, happy to. Pacific Health Alliance, 1-800-533-4742.
Great, thank you very much. Going back to you, Dr. Moreno, with a question. With the lifting of COVID-19 restrictions this week, what should people be doing as long as the virus is still part of life?
Yeah, I think what people here in Monterey County need to do is to read and become very familiar with the California Department of Public Health guidance that's now in effect. And there are the guidance documents provide, I think, enough detail to inform Monterey County residents and Californians. Though I know that sometimes guidance documents may be a little difficult to really understand and interpret for many of us. So the state of California is also issuing frequently asked questions that they're posting on the website. And there's also some pamphlets that are available on the California Department of Public Health website that goes over a variety of topics, and for example, travel. What's the recommendation for people who are vaccinated who plan to travel, or unvaccinated plan to travel, and individuals traveling internationally. So I think it's really important for people to be familiar with accessing those the guidance documents, and also looking at frequently asked questions at the state website too, because they may be able to find answers to their questions at those website locations. I also think it's important that we continue to show respect for one another. We have individuals that feel much more comfortable removing their face coverings and narrowing the distance between themselves and others. But we also still have some people who are unvaccinated or have weak immune systems that, even though they're vaccinated, they could contract COVID-19 and become very sick. So we can be respectful of an individual's decision to continue to protect themselves and others by wearing face coverings. But I think, again, we should really get all of us should get more familiar with the guidance documents and the supportive documents at the California Department of Public Health website.
Actually, speaking of that, Dr. Moreno, that kind of fits in with our next question. This is a question about what are the regulations for nightclubs, such as maximum capacity? Is that information people can find on the state website?
Yeah, thanks. Yeah, that's information. Well, actually, Matt, the business sector guidance documents that I mentioned have been removed. They're no longer in effect. So if someone's looking for a guidance document for nightclubs, they're probably not going to find one. And so they should, if they're a business owner, they should go to the Cal-OSHA Emergency Temporary Standards and the Cal-OSHA Emergency Temporary Standards Frequently Asked Questions website to see if there's answers to the questions that they may have. If an event planner or business owner is looking to bring in more than 5,000 people in a indoor setting, then they would look at what's the guidance document entitled Beyond the Blueprint, and that covers mega events indoors, which are over 5,000 people, and the requirements for having a mega event indoors.
Thank you very much. And then we've got one last question in the queue here. Dr. Moreno, how well did you think you handled the COVID-19 crisis in Monterey County, and what, if anything, would you have done differently?
Thanks, man. So we're still in a pandemic, so my job isn't over, and everyone else that's been responding to the COVID are still working on pandemic and doing what they can to decrease COVID-19. I think the efforts to look at the response of the county or any other organization like hospitals or clinics, they're looking at their response, or even businesses, ag businesses and other businesses are looking at evaluating their response. Typically that happens in a analysis and report, an after action report that is issued. And I think if people are interested in seeing what that might look like, our Office of Emergency Services has already conducted the after action report. So I think that's one place that people can go to get an idea of how county government evaluates response and looks for opportunities to improve.
All right, thank you. There was a follow-up question to that about what your thoughts about work up until this point. Would you still refer people to the Office of Emergency After Action report?
If someone wants to see what an evaluation of county assessment of response looks like, Office of Emergency Services does that routinely after disasters. So there's one that was recently released and announced, I think, yesterday at the board meeting. And it's not new. These are the type of reports that are announcement reports that are done for other disasters. For example, the fires will often have a response to fires and other disasters will often have after action reports, and which include discussions on what improvements might be made for future responses.
All right, thank you very much. That is, there's an additional question about the report, and I'll get back to the reporter on that one to see if we can find some information out on that one. So that's all the questions that I have for the briefing for today. Are there, I'll leave a couple seconds here for any additional questions. And seeing none, that will wrap up our briefing for today. Thanks for joining us. We'll see you next week.